Hey guys, okay, so today we're gonna go over mechanical ventilators, just some of the settings and the modes that accompany them, and then we'll look at everything on the ventilator. Just a quick little video to hopefully help you understand vents a little bit better. So first, I'm gonna start by talking about the different components of mechanical ventilation. All of this information is in the critical care resource binder, so please feel free to grab it if you need more resources. So starting off, just understanding what some of the aspects are. Tidal volume is the amount of air in milliliters that's delivered to the patient. So it's basically the size of the breath that we deliver to them. PEEP is a positive end expiratory pressure. This is just something that the patient receives pretty steadily throughout the ventilation process, and all it does is allow for us to help keep the alveoli open. Alveolar collapse can be detrimental to patients who are intubated because that's when gas exchange occurs, is in the alveoli, and we want to make sure that they stay open. Pressure support is very different from PEEP. Pressure support is something that the patient receives while the inspiratory process happens, and it's given to patients on spontaneous breaths only. So it's just a little bit of positive airway pressure that they receive on inspiration when they take a breath to help them overcome the resistance of just breathing through a tube. FiO2 is the percentage of oxygen that they're receiving. Respiratory rate is how frequently we're giving them breaths or they're taking breaths. And then lastly, a peak pressure is basically going to tell us how much resistance the ventilator is experiencing giving the patient a breath. So when you have higher peak pressures, it can not only be a sign of something going wrong with the ventilator tubing or the ET tube itself, but also non-compliance or stiffness of the patient's lungs. So we'll talk about peak pressures a little bit more in our troubleshooting of the ventilator video, but a peak pressure just basically tells you, is the patient being ventilated with a little or a lot of resistance? I'm going to jump up here to the different modes of ventilation. Starting off, I like to start with volume control. This is the mode that we use most frequently on our unit in particular. So we're going to start with AC, this one over here, just because assist control is probably the easiest to understand, I think. Really, when you talk about volume control settings, you're just talking about giving the patient a set tidal volume, and that'll be important later when we talk about pressure control. But with volume controls, like I said, you're giving them a set tidal volume, which is the size of the breath the ventilator is administering. On assist control, the patient's going to have that set tidal volume. We're going to determine how big of a breath we're going to give. They're going to have that set PEEP, just that little bit of pressure that's administered kind of throughout the entire inspiration and expiration process, just to keep the alveoli open. FiO2, which is the percentage of oxygen, and lastly, a rate. I think the key thing to understand on assist control is that the ventilator does everything. So the patient can initiate spontaneous breaths. Of course, they can always breathe over the vent. However, on assist control, if they choose to try and initiate a spontaneous breath, the ventilator takes over and it administers the settings that are already put into the vent. So we'll say, for example, the patient is receiving a tidal volume of 500 cc's of air, and their respiratory rate is set for 20. If the patient breathes over that 20 set rate, each time they initiate a spontaneous breath, the ventilator is going to give them that entire 500 cc's of air. Switching over to SIMV, it's very similar. Synchronized intermittent mechanical ventilation. This is a mode that our trauma team likes to use a lot. It's very similar to AC. Really, the only difference is your pressure support. So you still have that set tidal volume, how big the breath is. You have the set PEEP to keep the alveoli open. You have a oxygen percentage, FiO2, a set rate, and then additionally you have a set pressure support. And the pressure support, again, if you reference the beginning of the video, is just a positive inspiratory pressure to help the patient overcome the resistance of breathing through the endotracheal tube. And the reason they need a pressure support on SIMV is because their spontaneous breaths are their own, which means that when they take a spontaneous breath, the ventilator just needs to give them a little bit of pressure support to help overcome that resistance, versus AC, it takes over and gives them the full breath. On SIMV, their spontaneous breaths are their own. We just give them a little bit of help with pressure support. I'll come back to this. Moving over to pressure control, it is very similar. The difference with pressure control is that instead of setting a tidal volume, you set a pressure. So this is a good mode of ventilation. We don't see it that often in our ICU in particular, but it's a good mode of ventilation for patients who have poorly compliant lungs to the ventilator because it just allows their lungs to receive whatever tidal volume the patient is comfortable receiving. Typically, we will set a pressure that targets a certain volume of air because, of course, we want them to ventilate. But you basically just choose to set a pressure instead of setting a tidal volume. This is always a great mode, like I said, for patients who have stiff and non-compliant lungs. If you ever see this, just grab your RT and ask them to kind of fill you in a little more. They're really great resources. And again, we don't see this a lot. So I'm gonna lean more heavily on volume control, but that's really what pressure control is, just setting a set pressure instead of a set tidal volume. Lastly, spontaneous mode, or CPAP, we call it frequently. So this is basically our weaning parameter. The patient needs to be able to tolerate CPAP, obviously, before we can extubate them. This is where the patient takes all of their breaths. They can breathe as frequently as they want. They can take as big or as little breaths as they want. The only thing that we do set on this is going to be a little PEEP, going to be a oxygen percentage because we're still giving them FiO2. And then we are going to set a pressure support because, again, this is a spontaneous mode of breathing where anytime the patient takes a spontaneous breath, they need that little bit of positive airway pressure through pressure support to just help overcome the resistance of breathing through the tube or kind of breathing through a straw. I'm going to come back to VC Plus at the end of the video because I think it'll make more sense then. But those are really the three modes. So I'd like to step over to the ventilator and kind of go over what you're going to see. So when we look at the ventilator, I like to break it into kind of two parts. The bottom part is what is set for the patient. The top part is more so what the patient is doing. So looking at the bottom, we talked about all the different modes, what they mean. I think the best way to learn and get better at that is to just look at your ventilator every morning and kind of practice assessing what mode they're on, what their rate is, and what their settings are. So looking here, you're going to see your mode over in the corner. Typically, we do have several types of ventilators, but looking at the bottom half, you can usually figure out what numbers mean what. So our patient in here is on AC. She's set at a rate of 14 with a tidal volume of 450. These other numbers are they're not nearly as important to us in the settings. These are a little bit more intricate and more respiratory scope of care. She's on 40% and 5 of PEEP. You notice she is not on a pressure support because she's on AC, and you don't need a pressure support because on assist control, when the patient initiates a spontaneous breath, the ventilator gives them whatever the settings are, which would be in this case 450 cc's of air. Coming to the top of the ventilator, I like to start over here. This is the tidal volume that the patient is receiving, which is great. Our tidal volume is set at 450. Her lungs are receiving that and then some. So her tidal volumes are consistently, around that high 300 to 450 mark. And that's how you know whether or not your patient is getting tidal volumes in comparison to what the vent is set at. Her rate is 18, so she is breathing slightly over the ventilator, meaning her rate is set at 14. She's breathing 17, 18 breaths per minute. And you can see when she takes her breaths, they're all green, which just indicates that the ventilator is doing all of the work. So even though she is breathing over, each breath she spontaneously initiates, again, because she's on AC, the ventilator takes over and gives her that breath. And then last but not least, we talked about this in the beginning of the video, peak pressures. This is just kind of our indication of how much resistance or how compliant the patient is to receiving breaths from the ventilator. This can be a little tricky, and I'm going to go over it a little bit more in our troubleshooting video, but it does tell you whether or not the patient is compliant, and also it tells you a lot about your ventilator tubing and ET tube. You can see high peak pressures with not only, the patient coughing or stiff lungs, but also if the patient is biting on their ET tube or the ventilator tubing is kinked. Conversely, you'll see low peak pressures if the ventilator tubing is disconnected because there's no pressure, there's no resistance. So I like to associate the word resistance with peak pressures because it just tells you how easily the patient is receiving breaths. I hope that this is helpful. That is all that I have for you guys. Check out the troubleshooting video. It will be helpful. Go be great nurses.